We want to go now to New York and CBS News Chief Medical Correspondent Dr. Jon LaPook. Jon, thank you for being here this morning. Are you satisfied that the government has the right protocols in place here to prevent the spread of this disease?
I think the protocols are right, but the big question is there's a big difference sometimes between theory and practice. And unfortunately, with the first patient who ended up having Ebola coming into a hospital emergency room in Dallas, with them fumbling that, it undermines the public's confidence. But I think that said, this is not Africa. There is 40 years of experience with a couple of dozen of previous Ebola outbreaks in Africa, and they've all been successfully handled. So I think people should do this and say, this is not the time for magical thinking. This is the time to believe in science. There's experience. And I spoke to Dr. Frieden this morning, the head of the CDC. He said, we know how to stop this in its tracks, which is to isolate people who come down with it and then figure out who their contacts are, watch them closely.
All right, let's go over quickly. What are the symptoms and how is Ebola transmitted?
All right, well, the symptoms are really flu-like, so it can be headache, fever, aches and pains, nausea, vomiting, diarrhea, and late in the disease you can have some bleeding problems. This is very similar to flu-like symptoms, which is one of the reasons why I agree with your medical advice, Dr. Schieffer, that people should get vaccinated just to remove any kind of confusion.
All right.
It's spread by direct contact with fluids. And that's so important because I was on Twitter, I was on social media yesterday. It's the same misconception over and over again about how it's spread. It is spread through direct contact with body fluids, meaning vomit, diarrhea, stool, blood, sputum, even semen. So if you do not come into direct contact with that, then the odds of you having Ebola are extraordinarily low. You know, I think one of the problems that people have is they're talking about theory. You know, what happens if somebody sneezes in your face? Well, when was the last time somebody sneezed in your face? Yes, if there is fluid that goes into your nose, into your mouth, into your eyes, into a broken piece of skin, then you can get it. But across the room, there's no evidence that it gets finely aerosolized in the way that, say, the flu does. If this were spread like the flu, there would be millions and millions of cases.
All right. Thank you so much, Doctor.